Hi. Yeah, I'm sitting in my scrubs and such an interesting case today to discuss for the exam pattern of ADC. It's such a big coincidence. Actually, I'm sitting in my scrubs because I just came back from clinic and I saw that my son is still in the park. And before he comes, let me quickly shoot because I've been back to Dubai and yeah, I didn't get time to shoot at all. Craziness going on, utter craziness. Unfortunately, the mother-in-law of my assistant passed away, dental assistant, and she handles majorly everything of my patient calls and appointments, etc. So she is not there for 15 days. So I'm busy managing all that plus my three clinics, etc. So it's it's craziness. Plus my son's nursery is off because it's winter break, so he's at home. So basically, I cannot do anything, because if he sees me at home, then everything mummy has to do. Even if he wants to itch his nose, he's like, "Mummy, itch my nose because you will do everything of mine." And yeah, toddler life. So, anyways, before he turns up, let me just quickly finish this video. Now, today itself, I did an interesting case. I mean, it's not a new case, but such cases come rare. And the question, I just opened the mock test today and I was like, let me quickly shoot a video. And the same question is that I'm like, what a coincidence. So, anyways, before I move on to this question, I would like to share what I did today. So, this is the picture of extracted tooth. Do you look at it? You see this? So, this is a central incisor. So, there's an interesting story about this. This child is a bit autistic, but when spoken to calmly and patiently, he cooperates like really well. So he's currently 13 and he was around 7 year old when he had come to me. Wow, it's been 6 years. So so this particular tooth, he was somewhere else. He had a fall. He avulsed it 2-1. Okay, and he went to some other dentist who like put it back, splinted it, but did not initiate any root canal treatment, and the tooth was out for almost a day or so, kept in a dry medium. Okay, it wasn't kept in water, milk, or anything. It was just wrapped up in a tissue. And whoever the previous dentist was, he, I don't know what he did, he cleaned it and must have done a good job probably. But then within a month, so the patient thought the splinting is done and probably it's all okay, but when he removed the splint, within a week or so, the tooth started moving and it was quite wobbly. So they went to that dentist again and he said he just did what he could and they should actually go to a pediatric dentist, and that's how they found me online, and then they came to me in my clinic. So first of all, the child was a bit uncooperative at that age, and it was a really difficult task to coax him down to sit. And we had just one option because the tooth was almost, I remember, grade 3 mobile when he had come, but still a sufficient amount of root structure was there. The mother really wanted to save the tooth, and even I was thinking, at the age of 7, it's not great to lose a central incisor. And I mean, the situation was not that great, but it was worth an attempt to do a root canal and try pacification and see where it goes. So I explained everything to the mother, and I mean that lady's husband was an internal medicine doctor, so it was more easier to explain in medical terms. They were up for it. They were like, let's try to do a pacification procedure. The challenge was behavior modification, but we did that eventually, and the child sat, and I finished my pacification procedure. And within 6 months, the tooth just stopped being mobile, and we were also happy. So I said, but I don't guarantee anything about this tooth. It was an avulsed tooth, it was kept in a dry medium, and you are coming to me 1 month after it's reimplanted. And whatever I could do, I could do, and the tooth still has a bit of open apex and it's completely dead. So I don't guarantee anything. It may stay for a couple of more months, but eventually be prepared for an RPD. So we waited and waited, and every 3 or 6 months they came for checkup, and the child is growing and everything is fine. This can become a case study, you know. So at the age of 7, I've done that, and it's been 6 years now. So today, so yeah, this was since the last 3 months when they came last 3 months ago. There was a big break of like a year or so before they turned up. So the tooth was still lasting, you know, 7, 8, 9, 10, 11, 12. He's 13 years now. And I was so happy that this Eval's tooth lasted for that long, looking at the way it was reimplanted in such situations. But yeah, when they came last time and I took an X-ray, this entire area was external inflammatory resorption, completely eaten up. And the tooth did become wobbly, you know. It was like almost grade 3 mobile, and the gingiva around it started to change. So obviously, it was time that this tooth has to go. But the child is 13 now, and he's very comfortable because he's been coming to me for checkups regularly. So we have decided to go for an RPD until he's old enough to go for an implant. But I asked my brother, he's a prosthodontist, that how do I save that bone, you know, which is inside, so that implant can be used. So he told me to use a putty, the Easy Graft bone augmenting putty, and suture that area. So that's what I did today. I just extracted and I put those granules inside, and I packed it with ab gel. And yeah, that's it. Now I'm just going to give him an RPD after like a couple of weeks, and then we'll just observe, observe, observe until he's 17, and finally at the age of 18, aroundish, we'll go with an implant. So he sat, and thankfully he was very cooperative. And because I wasn't sure if the tooth would come out in toto, because on the X-ray it looked like a good fracture line out here, because you see how badly this is eaten up. But thankfully it came out like a little structure was left. I think a few more months we would have waited. This external inflammatory resorption would have just eaten up the entire area from the cervical. But you can still see my root canal apexification cement, you know. It's going right up till here from the other end. So I was like, wow. So anyways, this was one of those interesting cases where just miracles happen and science and the body just amazes you, you know, because rarely you find in literature something you know, trying to save an avulsed tooth after 1 month of its reimplantation, which was kept in a dry condition for almost 1 day. You know, it's quite huge. So, anyways, interesting case, and I'm just happy to share it with you all. So let's go back again to where, what did I do? Yeah. So to our mock, and we have a case, a 26-year-old female patient presents to your practice in the morning with her central incisor wrapped in a tissue, dry medium. Okay, she comes in the morning. Okay, so it's already been like what, 6 hours plus since whatever must have happened. Your clinic must have opened around 8 or 9, I guess. The patient fell over in a nightclub in the early hours of the morning and knocked her upper central incisor out. Ouch. She went to a hospital accident and emergency department where she was cleared of any other injuries. What are any other injuries? It's the neck. Neck injuries are very important. Only that injury is going to stop you from reimplanting the tooth. Otherwise, avulsion is an emergency dental treatment and you have to act fast, because the faster you act, the more chances of you saving the periodontal ligament. Avulsion is a periodontal emergency. Periodontal. The tooth is fine, the hard tissue is fine, it's a soft tissue injury. And was asked to see her dentist as soon as possible about her tooth. The tooth had been wrapped in tissue for about 5 hours. Okay, fair enough. Now that's the main scenario, but the sub questions can be asked purely on avulsion and not in this scenario. So you have to see what keywords are being asked in the sub question. Is it about this scenario, or it's in general about avulsion? Okay. So an avulsed tooth that has a shorter extraoral dry time that is less than 60 minutes requires splinting for 2 weeks. I know in my test there was a technical error which again I corrected. It's just 2 weeks, okay? It's not 4 weeks. The feedback is properly saying 2 weeks, but it keeps showing the answer 4 weeks. So don't go on that. It's 2 weeks only. So shorter extraoral dry time, less than 60 minutes, requires splinting for 2 weeks. Actually, according to the recent updated guidelines, any tooth which has been avulsed for whatever amount of dry time should be splinted only for 2 weeks, not more than that. Unless there is an alveolar bone fracture or a root fracture, then the splinting time increases. Otherwise, it's 2 weeks only. So yeah, that. Now the periodontal ligament cells can survive up to 6 hours if placed in milk. Water will cause osmosis. It's going to take away the water from the periodontal cells, causing them to shrink. Salty water will put more salt there, which is going to cause ballooning of it and create a problem. Air, no, they cannot survive in air. Milk is the right option. So immediately when avulsion happens, the earliest thing that you can find in the most fastest way is milk. There are grocery stores all around. I know there is one more question which says that which is a good medium to store the avulsed tooth, and the options will be milk, saline, and it would be HBSS. And a lot of candidates choose HBSS, which is not wrong. But you have to understand that grocery stores will not have HBSS, right? So the best medium to store if an injury happens in a playground or something is milk. Milk will be available. You cannot go to grocery store and say, give me HBSS. If the pharmacy is available, maybe they'll have HBSS, but I highly doubt it. So milk is a safer option, and nowadays recent studies are even comparing milk and HBSS, and they say they are act almost the same, you know. So yeah, clinical examination include all of the following except means everything is right except one line. Now, which is that one line? Soft tissue lacerations. Yes, you're going to look out if there is any other injury. The presence of periodontal disease and or caries and the level of oral hygiene. True. You're going to see if there is a gum problem or not. If there is a gum problem existing in that area, your reimplantation is going to fail like big time. So you have to see that the area is healthy. The tooth should be examined and cleaned by rinsing with isotonic saline. True, true. Examine tooth crown by handling the root. Ouch. That's a disaster. You will never touch the root. Whatever PDL ligaments, even microscopic, are remaining on it, have to be the way they are. That's the best chance for it to reattach. If you're going to manipulate the root area, you're going to destroy inadvertently so many things. So you should never hold this particular tooth by root. You will just hold it by enamel. That's the crown. So option D is the answer here, that you will not do this. That's the wrong statement. Any soft tissues adhering to apex should be left as they may contain Hertwig sheath remnants, which will help in regeneration of the periodontal ligaments. Yeah, that's right. Yeah, while speaking on all these questions, I'm just remembering how many avulsion cases I have done so far. I think it's around 10 or 11. And there are two, three cases in Dubai which I have reimplanted and they are still going strong, you know. Now, these cases came to me within 3 hours and they were mostly referred by other GPs, you know. See, avulsion is something which you will never know in BDS. Like, it's rare that you'll get a case, and it's not something that you can do and learn on it. It has to come to you by accident. So then only you'll get the confidence. And my son is here. Hello, Christmas boy. मम्मी क्लिनिक गए थे क्लिनिक तो बादशाह में मम्मी जस्ट एक वीडियो शूट करके आपके पास आती है ठीक है आज आपको बैठना है मम्मी के साथ आज कम sit here okay you sit there fair enough so which statement is wrong avulsed teeth with extraoral dry time of less than 60 minutes nothing but a plastic 60 minutes should be rinsed and reimplanted under local anesthesia. In this case, extraoral dry time was 5 hours. That's more than 60 minutes. Soak the tooth in sodium hypochlorite for 5 minutes. You can do that if the extraoral dry time is more and you feel the cells are not going to be viable. Then might as well just clean the entire root of it so that necrosis doesn't happen. What happened here? Mommy is here only. Beta. Let me shoot this video. Just two more questions, okay, please? Soak tooth in 5% sodium fluoride for 20 minutes. It's right technically, but the percentage mentioned is wrong. It's not 5% sodium fluoride, it is 0.5% sodium fluoride. So that statement is wrong and that becomes your answer. Root canal treatment within 7 to 10 days. Actually, in extraoral dry time exceeding for this many hours, it's better that you do the root canal immediately, no touching anything, beta, and then reimplant that tooth. If possible, root canal treatment before implanting, that's true. And if it's like you are immediately reimplanting it, if the tooth has come to you immediately after avulsion, then you can do that, splint it, and then do RCT in closed apex. Yes, yes. What happened? What happened to your tooth? क्या खाना है? अच्छा जा पानी पी कर आओ, जाओ. Have some water. Get a water bottle. Go. Mummy's here only. Mummy's not going anywhere now. Mummy's back from clinic. Uh, yeah, so if it's a closed apex case and you get the tooth immediately, like within an hour of avulsion, you will just splint it, and probably you can initiate root canal immediately or within 7 to 10 days. If it's an open apex, then you just observe, observe, observe. But if the extraoral dry time is quite long, I would say if it exceeds like 3, 4, or 5 hours, then definitely the PDL ligaments, if it's not soaked in a wet medium, they are probably dead. So in that scenario, might as well just do the root canal and then reimplant the tooth. Post-operative instructions include all of the following except do not brush your teeth. No, you should always brush your teeth. Do brush your teeth normally, yes. Cut food before eating, yes, so that pressure is not there. And do not cut food with anterior teeth. That is also true. For a couple of weeks, you will ask the patient not to give too much pressure on that tooth which is splinted. And but do not brush your teeth is not that instruction. You should always brush your teeth, right? Yes or no? Okay. Do you eat chocolate? Yeah. No. What happens when you eat chocolate? मम्मी कुछ नहीं बोली. But आप chocolate खा के brush करते हो? नहीं. You have to brush your teeth. Tell everybody you have to brush your teeth after chocolate. Tell them. Say yes. Brush your teeth after chocolate. बोलो. बोल. Okay, I taught you something. Let's have some fun. Say tooth. Ball. Tooth. Enamel. Don't behave like this. You say all these things. Say enamel. Dentine. Pulp. Root canal. Endodontics. Periodontics. अच्छा, what is mummy? मेरी mummy? What is mummy? मम्मी क्या काम करती है? Dentist. Pediatric dentist. इवन क्या बनेगा बड़ा होके? ऑप्थेल्मोलॉजिस्ट, कार्डियोलॉजिस्ट, डेंटिस्ट, क्या बनेगा? डेंटिस्ट. मम्मी बनेगा मम्मी. मम्मी बनेगा मम्मी. ओके, बाय बाय कर दे. बोल हैप्पी क्रिसमस. हैप्पी क्रिसमस. All right, fine. End this video. I cannot shoot anymore. But please read about avulsion, and please read about various storage mediums. Please read about what splint to use. Yeah, I would just like to add, use a night eye wire for splinting or a stainless steel wire for splinting. These two wires are good for splinting. So yeah, that's it, and we'll discuss more on this later on. So have a nice day. Bye bye. Yes, beta.